I mean, dentists are very clear when they look in a patient's mouth that, yes, there's excessive wear going on. There's kind of shiny facets where the teeth are rubbing against each other. So that's a telltale sign of bruxism. And of course, the other ones are just, as I said, tooth wear, excessive fractures of teeth, that kind of thing. Are all signs, and headaches. So headaches that occur in the morning, and often, and especially if it's more what we call tension type headaches or both sides, that tends to be one of the cardinal signs of bruxism.
As a physician specializing in sleep problems, is your job made even more complicated when people present with more than one condition that's affecting their sleep?